Today we've been welcomed into the office of Dr. Ricky Tin at Villa Vista Dental. Come on in, take a look around, and welcome to the Dental Evangelist, this special Cribs edition. Come on, let's check it out.
Hey Rick!
Hey, how's it going?
Welcome to my practice.
Yeah, thanks.
Come on in.
Right.
Let me show you around. Hey, I'm Dr. Ricky Tin, founder, owner, and dentist of Villa Vista Dental, and I'm welcoming Rick here today to my office so I can show him around. So what you're looking at here is the newest rendition of our practice. We just got done remodeling this, what we call the older side of the practice, just a few months ago. This older side, we've been here since 2009. And I built my practice from scratch with 0 patients at the time with the help of Rick. Right, so of course we have a check-in counter. And we really wanted an open concept in our practice. So one of the things that I want patients to notice, and what many have noticed, is that we don't have doors breaking up our front office from our back office. So here we are with obviously our logo. We have our checkout area. We have this little neat area right in here, which my wife designed. And this is meant to display maybe birthday celebrations and such. It's a chalkboard, so it's just a neat little thing that we incorporated in. So anything that we can incorporate in, like little touches where patients, when they first walk in, will feel that custom touch. Right? This is another example here, right? Little details that my wife, who is quite the interior designer, has worked in. And then over here to the directly in front of you, that is our from our mission statement. So we firmly believe here at our practice that we first care for people, first and foremost, and along the way we happen to do dentistry. So my staff perfectly understands it, and our patients can see the difference. Right over here behind you here is our imaging room. We have CBCT. And over here, this was supposed to be, well, first off, when we first opened, this was my office. So we opened with 4 operatories, and of course we kind of outgrew ourselves. So one little tip is think big, right? Don't confine yourself to 4 operatories, because we quickly outgrew the 4 operatories that we initially built out. But my office turned into kind of I think for a little while, a lab or something like that. And this is actually plumbed to be a hygiene room, but I've always long wanted to have a photography room. So we kind of turned this into a photography room, which is nice. So we're looking at our original 4 operatories. So when I first built this place, we started with 2 operatories, and from 2 we went to 4. I think it was a matter of 2 years. I remember 2 or 3 years or something like that. Because remember, I opened from scratch. It was just myself and an assistant, and then I think a couple years, 2 or 3 years down the road, we incorporated in a hygienist. So we were able to expand to 4. So we started with 2 operatories. So these are the original 2 operatories that we built out. Now, if you notice, we went with a lot of cabinetry on the sides, and we went with the side delivery on the doctor's side, which is great, but when we first built the operatory, we didn't incorporate in a lot of space. So as you can see, we're really close to the wall here. So with this type of a setup, it looks a little cluttered. So when we built out our 3rd and 4th operatories, we went minimal with the cabinets, and we went with rear delivery. And I found that worked out a lot better. Like the room is more open, so there's less clutter around the patient. And that worked out really, really well. And of course, the patients, don't see the instruments and such. So the overall theme for our practice is Italian, Mediterranean. We just want patients not to feel like they're in a dental office. And my wife and I just love Italy. That's where we went on our honeymoon. My wife, she's an amateur interior designer. So of course, she is the one who incorporated all of this, all of the details into our practice. So here's our really long sterilization area. So, like I mentioned earlier, we extended our practice, right? So we started off with about 2,000 square feet back in 2009, and we're at a total of almost roughly 4,000 now. So we kind of doubled. And it used to be that I think the wall was like right here. So we needed a place to put our sterilization center. And this is what we came up with. We just came up with a really nice and long and clean sterilization center that both sides of the practice can utilize. Going back here, our lab, right? I do a lot of in-house dentistry with Cerec, so it was really important to us to have a nice lab to support all of that. We have, the 3D printers. We have 3D printers over here as well, so it's 2 iterations of 3D printers. We have the old Cerec milling unit. We have the ovens. Technology is very, very important. And we got away with stone, and basically we don't pour up models anymore. So I think nowadays that's a must, right? Is to kind of advance towards technology. So I think we're mostly there. We got rid of all the stone and the pouring up models and such. So we don't pour up models anymore. Everything's 3D printed and everything's milled in-house. So now we're approaching what we call the new side of the office, right? Still same thing. We have the Mediterranean and Italian theme going. So we'll take a peek into the operatories in a little bit, but let's come this way and look at our staff lounge. We used to have a tiny little staff lounge, and in building out the new practice, it was very important for me to have a more spacious place for my staff to go and to kind of unwind, and it's important that they feel valued as well. We don't build out every single space for the patients, right? In fact, this place is bigger than my own personal office, right? So we want to make sure that our staff lounge is a nice, comfortable space for our team members to kind of come unwind. And it's a great place for us to have meetings as well. So for anyone who's building out a practice, strongly consider building a nice space for your staff, because they'll see it and they'll appreciate it, and it's just another way to show them that you care. You ready to come on over here this side? So over here, on the other side, we have 4 operatories, which we have now designated as the hygiene rooms. So right here we added 6 operatories, or we call them suites, because they are enclosed, they're private. So we have, whereas on the other side, they're open bays over here. We started construction, I think, right when COVID hit, right? So back then there was that concern of, having private rooms and aerosol and such. So we went with the single door or single entry, single entry with a door, basically, right? So we wanted private rooms. So as you can see, that's what we did, right? We went with the single entry, and we went with the continental delivery, which I love. It has made dentistry a lot, easier on myself. So when you have a chance to go to continental, do it. So on this side, we went with a more spacious room, so I was able to do the doctor side delivery, leaving the rear side more accessible for the assistants to go in and out. We have dual monitors in the rear. I think for anyone building a practice, that's critical. You know, I have our practice management system on one monitor, and we have X-rays on the other. And nowadays we also have 3D scans, and we just have a lot going on our computer. So it's nice to view everything all together. So in our operatories, just like on the other side, we have the front monitor, front TV for the patients, and also over here we went with much bigger TVs. I think that's a 55 inch TV in the ceiling, and this one here actually has the ability to also change viewing angle for the patients as well. So we went with 4 traditional treatment rooms for myself, and then we also incorporated into surgical suites. So they're more spacious, allowing for more room to work during surgeries. Yeah, so these are our surgical suites, and this one looks very, very similar. A lot more counter space in the back. These are plumbed for nitrous. And then kind of this practice is kind of like a big full circle, right? So we've walked in and we kind of circled around. So that's the flow of the practice. Check in, go to hygiene, and then treatment is on this side. And now we're kind of ending up over here in the checkout area. So this is where patients would check out. Over here is our consultation room, where we would sit and have conversations with our patients. We can do a case presentation. This is mainly where the treatment coordinator would sit and go over treatment with the patients. And again, just in keeping with the theme of the entire practice, we wanted something really nice and aesthetic. And patients can tell, right? Patients, the level of detail that we've placed into this practice, hopefully they will see as how it translates to the level of detail that we would also incorporate into their dentistry. And then we placed our newest Cerec milling unit, the Cerec Prime Mill, front and center for patients to see as they walk in and out of our practice. And we have a sign up there that says same day crowns, and we get asked daily, what is this machine for? So we've kind of picked the perfect spot for it. Patients walking by will often ask, what does this machine do? So yeah, that's the tour of our office, right? So going from 4 operatories to now 10, going from 2,000 square feet to now 4,000 square feet. So we've been through it all. So hopefully you enjoyed the tour, and now it's time for you to get out of here.